presenting our sponsor, the incredible No Solo brand. Newport founded by John and Sarah Torresenta. Discover No Solo's well-crafted hats, stylish tees, and cozy sweatshirts at their website, nosolobrand.com. That's NOSOLOBRAND.com. We love supporting locally owned businesses here at Totally Preventable, especially those that give back to our community in the way that No Solo does. No Solo proudly supports mental health awareness with a percentage of your purchase going to the National Alliance on Mental Illness. So join the cause, embrace comfort and style, and support a fantastic local business when you buy from No Solo. Visit No Solo's online store at nosolobrand.com. So support No Solo today, where local ownership meets fashion with purpose. Hey, Polly.
Hey, Greg, how are you?
I'm all right. Ready for another podcast today.
I'm ready. Who is it?
All right. Well, today we have a Totally Preventable alum coming on. We have director, producer, writer, creator, Debra and Kathleen coming back, the creator of the Listen to the Silence movie that will be premiering.
Oh, yeah.
Yeah.
In March.
In March, yep. This time we'll be joined by Kathleen Brugeli, our very own opioids grant coordinator. So this is going to be a good one.
Right. So we can hear about the film and hear all about how to get tickets.
That's right. That's right. We're also going to learn a lot about this opioid crisis and how it affects Rhode Island as well. So I know the movie's not specifically based in Rhode Island, but the
opioid crisis has no borders.
Thank you.
You're welcome.
Thank you. So without further ado, today joining us on the Totally Preventable podcast, we have our Totally Preventable alumni with us, Debra and Kathleen, the queen of all, the producer, the writer, the creator, the narrator of Listen to the Silence, the women lost in the opioid crisis, and also joining us, opioid grant coordinator for the Newport County, Kathleen Brugeli. How are you both doing today?
Terrific. Thank you for having me.
Yeah, very well. And I appreciate that listing of my many titles. Some real, some only in my head.
They're still real.
That's right. That's right.
Great to see you both again. So this is a follow-up because we want to promote a great event we're going to be having in the county in just a few weeks, March 11th.
That's right.
Kathleen, would you like to tell us about this event?
Sure. The Newport County Prevention Coalition is sponsoring Debra's documentary, which is the only documentary about women in the opioid crisis. It highlights the issues that women face with addiction. It's going to be on March 11th from 7 to roughly 9 p.m. It's going to be a documentary screening followed by a panel discussion. And I think it's going to be a really great event.
Now, I'm a big proponent of people helping people and networking. How did this relationship come about? How did you come across the movie, or how did you come across with Debra? Which came first?
And I reached out to Debra, and we went from there. We've been working very closely ever since. The film is going to be screened at Jane Pickens in Newport. I forgot to say that.
It's all right.
Yeah, that's great. So what is your panel going to look like? Who's on your panel?
Well, right now we have Debra and we have Rebecca Armstrong, who's one of the subjects of the film. And I think Rebecca Elwell, our executive director, is thinking about adding a person or two, to be decided. I think it's going to be an exciting, and I think it's going to be a very insightful discussion. It's not something that we talk about, and it's a national issue. So, the more exposure we can get, the better.
Now, in your research and your connection with Debra, have you stumbled across any information that you did not know coming into the opioid grant work?
Actually, yes, I have been looking at specifically Rhode Island and addressing the need for women's rehabs here that accommodate the needs of women. And right now, for a population of 1.1 million, we have 247 beds in Rhode Island, in the state. Of those beds, only 22% are earmarked for women, and women represent 51% of the population. So we definitely have room for improvement. And I think the more we talk about this, the more likely we are to get a positive outcome.
Awesome. Deborah, can you tell us a little bit
I
about?
think, well, I think I want to follow up with that because I think those numbers tell, are very, really tell a story, but that story is limited. So if there's 257 beds, and what percent of those beds were allocated for women?
22.
So 22. So 22, and then we have women that are coming from very, very diverse backgrounds. So we have women that may be pregnant. We have women that may be new mothers. We have women that may be older that have been prescribed opioids for 20, 25 years. We have women that may have children in school. So how would they go about getting help or going into recovery if they need to be in a in-person recovery center? Most rehabilitation facilities do not allow the children. There are liability issues. And so the number of facilities throughout the country that even allow children of mothers to reside there is less than 1%. That's throughout the entire country. So, people are always castigating and throwing blame on women not going into recovery. I'm hard pressed to know how a woman can go into recovery, can find a reasonable facility if they actually don't exist, if they can't take her children in with her. How would that work?
That and the fact that women just, not just the children, but the fact that they may have children removed from their custody,
Correct.
and the possible stigma associated with, being an addict. Those 247 beds, by the way, are not just for opioids. Those are for substance use disorders. So it's a very, very small fraction of a percentage.
And I believe they're all full too.
Right now, yeah, there are 111 people on the waiting list as of yesterday.
Horrifying. Could you tell us a little bit about the film, Deborah? Without giving it away. We still want people to come.
Sure. I think that anyone coming to see the film will be really, really surprised at the breadth of the film. And what I mean by that is that there are many different women in the film. There are the stories of many different women, and there are stories from many different backgrounds. This is people always call it an equal opportunity disease. So there are older women, there are young women, there are women of color, there are American Native women, there are women who, probably the majority of the women in the film, started using opioids because they were prescribed by a doctor. And we all have a tendency to believe that if a doctor is prescribing something for you, that's fine, you should take it. But there are also the stories of women who do what I certainly did when I was a young woman, and that is of women experimenting with drugs. Little did they know that experimentation was going to literally get their body addicted in a way that they never planned for. So there seems to be a disparagement about women who somebody gave them a pill at a party, and it was a party, and they were in college, and they thought, yeah, why not? And then they went to another party after that, and a couple of days later, they noticed that they really felt funny, and if they went and got a pill, they felt better. And they didn't realize that they literally were going down a very deep rabbit hole. And it does not take long. It doesn't even take a week. It takes 3 to 4 days. And your body starts craving that pill. And if you just don't know, you'll look for the pill to feel better. All of us want to feel better. And I think it's the stories of all these women who, God had an injury, a back injury or a knee injury playing soccer and was given these pills. It used to be that they were given lots of pills. The doctor would prescribe lots of them, a 30-day supply of pills, which we know now is beyond excessive. But if you got a 30-day supply of pills, and if you were told to take 4 pills a day, one every number of hours, and you had that for 30 days, a week into that, you're going to be taking pills and you're going to want those pills. And then when the government, as somebody says in the film, when the government kind of cracks down and sees, wow, this dosage is all wrong and that these pills are addictive, then what do people do? They still need something. It's not like everyone who's on pills immediately goes into recovery. No, they look for something else, and that something else is even worse, is heroin. Right. And that can happen to anyone. It seems like it's other people, but in actuality, it can happen to anyone. And that's what I love about the film. There are 2 women in the film who are in their 60s. One was given opioids for her fibromyalgia. Nobody knew what it was, fibromyalgia, years ago, and they just gave medication to women. And, she's never increased her dosage. She's not looking for anything else, but she was on, when we met her, she'd been on fentanyl patches for years and years and years. We have so stigmatized the use of medication that, we think of people as being lesser than we are. And it's just not true. It could be anyone.
Right.
That's right.
We hear the stigma a lot when trying to train people in Narcan. The amount of times we hear, oh, we don't know those kind of people. I don't have those kind of people in my family. It's sad. It's very sad because people probably do have someone in their family struggling with some substance misuse, and they're probably afraid to admit it if that's what how their family thinks about people with substance misuse issues, So.
Well, there's a really amazing, there was an amazing woman named Reverend Fortune, and she was speaking at the UN years ago on intimate partner violence, what people know as domestic violence. And she said, okay, if there's anyone here who's been a victim of domestic violence, please raise your hand. And maybe a third of the people, maybe a quarter of the people raised their hands. And then she said, if you know of somebody who's been a victim, and then another quarter or another third raise their hand. And then she said, and all of the rest of you raise your hands, because you may not think you know someone, but you know someone who is a victim. And that's the same thing with opioids. Nobody's out there saying, oh yeah, me, I need to take, I'm on a fentanyl patch, or I need to take these opioids because I had a compression fracture in my back. But somebody who maybe not using them in a maybe using them in a socially acceptable way with a prescription, but their bodies are physically have built up a physical tolerance and they need them. And that's just all around us.
Kathleen, what's your target audience for this premiere?
I have a very broad audience. I think that anybody who has any interest in addiction, who has a family member that's affected, who wants to learn more, I think it's relevant. I think it's timely. I think it's something we should have been talking about. And I I hope that we'll be talking about more. I have spoken with a lot of different organizations about this, and I've received nothing but positive feedback. So I'd love to see people in recovery. I'd love to see people in treatment. I'd love to see law enforcement. And the list goes on. You know, I'd like to see representation from across the spectrum.
Is it appropriate for teenagers?
Yeah, I think it is. I don't think there's anything in there that would be, I think that actually, especially high school,
High school age kids? Sure.
yeah, and older it would be very relevant. It's an awareness, and it's something that we all need. And, you know, speaking to what Debra said, Nora Volker said last week, that addiction is an altering of the chemicals in the brain. So it's it's a disease. It's not a personal failing or a character flaw. And I think that's an important element that is brought to light in this film. People can recover, and people do recover. And seeing that is powerful. I think it's moving, and I think we're really going to enjoy it.
What do you hope will come out of this public viewing?
I would like to see more conversation. I want people talking about it. I want more interaction. I'd love to see women in recovery at the event. And I moving forward, I want this to be the beginning of something. So, you know, my intention certainly is to follow up with people that attend and try to keep promoting and keep the conversation going. But I think even from an awareness, from an exposure standpoint, it's impactful. And I think that it certainly has impacted me. You know, I'm looking at this issue from a completely different perspective than I was when we started speaking, you know, about the potential here. And I think that everybody should have that sort of enlightened state. And I think we can affect some change.
So what I have a very different goal with the film. I would love it to be a catalyst for a woman who might consider you know, finding out about recovery for herself, or someone who has a family member, and this is something that can be an impetus for helping them go into recovery. But I want people to see this film and then do something actively, and that action is to call their local official and find out where Rhode Island's portion of the $54 billion of opioid litigation settlement monies is going. Every state is getting money. I understand completely that money is not coming all at one time. It's over a 17-year period. But we're talking about $54 billion, and most of us can't even wrap our heads around how much money that is. So if you can imagine that a big chunk is coming to Rhode Island, well, who's in charge of that? Where is it going? Is it, most states have some sort of variation that it goes to the state, and then it may go to the counties, and may go to a third entity. And so any permutation of that is how it's how the state takes it. But then what happens? Is there transparency? Do people know where it's going? Does it get caught up in the state and then just sit there? Is it used to balance budgets at the end, which is really what happened with the tobacco settlement monies? Those monies, in the end, only 1 cent to 2 cents out of every dollar was actually earmarked for tobacco education and helping people not start smoking. And, you know, I want people asking, where is the money going in Rhode Island? And how can we make sure that there is significant resources for women?
Yes. And you know, it's funny that you say that because yesterday they had the opioid settlement advisory committee meeting last Wednesday. And I reviewed the committee. It's made up of 17 representatives from a representative from the governor on down. The opioid funds in Rhode Island are split 80-20. So 80 goes to the state, 20% goes to the individual communities. We do have a website. It's called Prevent Overdose RI, and that is in its infancy. I think they're just beginning to set that up and have it track where the money is going in an effort to be transparent about it. Is it transparent? Not yet. Is it trying to be transparent? Absolutely. So I'd give them kudos for that. Is there room for improvement? 100%. But I think that can be said of all of us. You know, we all can do better.
I know there's some allowable expenditures supposedly with the money, and some of our coalitions have good relationship with our towns and are able to advise or help or at least know where the money is going, but it seems to be different from different communities. So I love a good call to action. I think that's
Well, I think that if we don't raise our voices, it's pretty easy if nobody's saying anything for people to make decisions based on whatever, a squeaky wheel or somebody's advocacy. But if we all actually were to just make one call and say, where is the money going to? And I really want a significant resources for women. I think that one would be surprised the power of all of the people at the screening, you know, would be really something that good legislative elected officials would answer to, because they would want to.
Yeah.
We'll have to have the good legislators there.
Well, also, in addition to this in-person screening, we're going to have the film available to screen remotely. So there's any number of people that can view this statewide. And it's not even statewide, it's whoever has the link.
Is it going to be available at the same time?
There'll be a window of opportunity right around.
Okay, gotcha.
And the flyers will be going out. All the flyers have a UPC code that you can scan. It will lead you directly to the Eventbrite page where you can reserve tickets. The tickets are free. And we would love to see that. You know, it's funny because I talked to Jane Pickens last week and they were explaining to me that they have about 450 seats in the theater. But if we go above 300, then we have to pay the Newport Fire Department a fee to come and send a detachment. Well, I really hope that we have to pay that fee.
Yes. That should be your goal, to have to pay.
It is.
Yes. I bet the fire department would waive their fee for us.
Probably.
Debra, any thought to a follow-up to this?
To a follow-up to
listen to the silence?
There is there is so much material in here, and then there is so many things that I didn't have a chance to discuss. So I really am appalled at the situation of women who are incarcerated, because half of the states basically don't allow Medicaid. If a woman is on medicated assisted treatment, that's not allowed. So they don't get their medication. And quite frankly, I understand that I'm not a lawyer, but I don't understand how medication can be withheld from somebody who's on medication. If you had diabetes and they withheld your diabetes medication, man, oh man, would there be a lawyer waiting outside to take on, and rightfully so, your case. So how can this medication assisted treatment not be allowed? I don't know, but that's the case in half the states. I know that if you think that, I know that women suffer from the stigma of opioid use disorder more than men. With men, it's just, oh, that Uncle Joey, he's just doing his thing again. With women, it's, oh my God, you know, how can you as a mother? I mean, the stigma is so much more, and that's also incarcerated. So nobody even wants to hear about women incarcerated, and I think in many cases their situation is just untenable. And then you have states that test for, if when a baby's born, does tests not with the approval of the mother, but testing for any indication or evidence of any drugs in the baby's system. And some states will remove if they find that the baby has evidence of drugs, will remove the baby from the mother. And we know, we have the research. It's not like this is an opinion thing, that, removing the baby from the baby's mother right after birth is just a recipe for disaster, which is why there are, only a few, and there needs to be many more places like Maddie's Place, which is a place in Spokane, Washington, which goes and gets mothers and babies and takes them to Maddie's Place, where they're given a facility to get healthy again. And it just started in October of 22, and now they are, they started with 5 babies. I think they've had 54 babies and moms graduate there, and they're really enormously successful, but it needs to be replicated. We can't only have 4 of these facilities throughout the country. Maybe 4 in Rhode Island, I'll accept.
Maybe.
But not 4 in all of the country. So we really need to look at how we're treating moms and their babies, and women in general, both older women, younger women, women who have experienced trauma, whether it's trauma from their own childhood experience or intergenerational historical trauma, as Native American Indians from different tribes have experienced. And we need to take this money. So what's next is, I have probably 2 or 3 documentaries staying in this arena, but I also, which is a bit of a change, since I historically have done documentaries on social justice issues, but I've been a big believer in taking time out every day. I'm doing okay. I'm really grateful, whether it's for the malted milk balls or for your cats or for your friends. As I said in the very first video I did about gratitude, and be thankful that people you work with, and that there's just, even on bad days when I really think to myself, I don't know, there's always something. There always is. And so I may be doing that might be the next one that I explore.
All right, we got the exclusive.
Right?
You heard it here first on Totally Preventable.
Totally preventable.
Kathleen, can you remind us of, unless you had something else to ask?
No,
Okay.
time.
Can you remind us of the information about the film, where it's going to be, what time, all
Sure.
that good stuff, where to get tickets?
The film will be on March 11th, 2024, from 7 to 9 at the Jane Pickens Theater in Newport, Rhode Island. It will also be simultaneously screened. And I believe that on the Eventbrite, if you put in Listen to the Silence, our page will come up. You can reserve tickets there. They're free. And I encourage, people to reserve your tickets, get there early because it's not a huge space. And I would love to see some fresh faces.
All right.
Awesome. I guess that means she doesn't want to see us.
Exactly.
Yeah, I definitely want to see you.
We're old
And
news.
there'll be a panel, myself, and as Kathleen said, one of the really amazing women in the film named Rebecca Armstrong, who was a homeless person for 6 or 7 months living in Baltimore in basically a bombed out building. And then she realized she was pregnant, and she had children. They were with her parents because she was actively using, and she realized she wanted a better life for her baby, and this was no life. So she went into called up Johns Hopkins and was taken into a facility, and she is today, amazingly articulate and really can is just an astonishing person. And we're there even after the panel. We'll answer any question. We'll talk to anyone about how we can help and what we can do and how they can help, and call and really try to make a difference for women.
That is great.
Awesome. Thank you both for all this great information. We hope the Jane Pickens Theater is full.
Jam-packed.
Absolutely.
Surrounded by
Absolutely. Well, thank you for having us on. We really do appreciate it. And we, Kathleen and I are committed to getting the word out, not only about the film, but the film is a vehicle to let people know that this is a real issue for women and has to be, the resources have to be there. And this is not a matter of, well, it was her choice, or it's a choice thing, or it's, why can't you just say no? Why can't you just stop? Once this disease gets hold of you, you have a disease, and there is a higher predilection genetically. So if you have a genetic propensity for this, once again, that's not something you could have done anything about. That's something that's that's in your genes. So let's stop blaming the women, and let's really call our elected official, and let's see what we can do to help.
All right.
Absolutely.
Well, we thank you both for your time, and we look forward
Thank you.
on March 11th.
Thank you. See you there.
Right.
Bye.